What medical tests are essential for preventing lupus organ damage? Living with lupus means staying vigilant about your health and catching any signs of organ involvement early. While there is no single test to diagnose lupus, a combination of tests helps doctors monitor and prevent organ damage. Regular blood and urine tests are key. The anti-nuclear antibody test is usually the first step. Most people with lupus test positive for this antibody, but it isn't specific to lupus alone. To get a clearer picture, doctors often check for specific antibodies like anti-double-stranded DNA and anti-Smith, which are more closely linked to lupus activity. These help assess how active the disease is and whether organs might be at risk. Blood tests also look for signs of inflammation, such as elevated erythrocyte sedimentation rate or C-reactive protein levels. These markers can indicate ongoing inflammation that might damage organs if not controlled. Kidney function tests, including serum creatinine and blood urea nitrogen, are important because lupus can cause kidney inflammation called lupus nephritis. Monitoring urine is equally vital. Urine tests check for protein, blood, or cellular casts, which can signal kidney damage. If these are abnormal, a kidney biopsy might be needed to determine the extent of damage and guide treatment. Liver function tests are also part of routine monitoring, as lupus can affect the liver. Additionally, imaging studies like echocardiograms or chest X-rays may be ordered if there are symptoms suggesting heart or lung involvement. For neurological symptoms, brain imaging or nerve conduction studies can help evaluate potential damage. Biopsies are sometimes necessary, especially if there are skin rashes or suspected kidney issues. A small skin or kidney tissue sample examined under a microscope can reveal autoimmune activity and guide treatment decisions. Regular monitoring is essential because lupus symptoms can flare unpredictably, and early detection of organ involvement allows for prompt treatment to prevent serious damage. It's important to remember that managing lupus is a team effort. Regular checkups with healthcare providers, especially rheumatologists, are crucial. They will tailor testing schedules based on your individual risk factors and disease activity. Always follow your doctor's advice and report any new or worsening symptoms promptly. These tests are vital tools in the ongoing effort to prevent organ damage and maintain quality of life. If you suspect lupus or are managing it, consult your healthcare professional for personalized testing and care plans. Staying informed and proactive is the best way to protect your health.